live?
Checking out. Yeah, I believe so.
Live?
Mm-hmm.
All right. Good afternoon. Today is January 29th, Friday. This is our weekly Friday session. Every week we are giving updates on medical community news. And I have Tanner with me from my office. He's part of our business development. My name is Kemal Erkan. I'm the chairman of United Medical ACO. And I also have other responsibilities with our surgery center, American Surgery Center, and also our business office, United Medical LLC. Our goal for these discussions is to bring everyone up to date with what we are doing. Initially, we started with for our patients. So then we have different sessions that we have available. And now we are also trying to make this more useful for the public. And hopefully everyone can find this useful and efficient. Now, Tanner, if you can please introduce yourself as well.
Sure. Thanks, Kemal. My name is Tanner Fuchs. As Kemal mentioned, I'm a member of the business development team here at United Medical. So I work closely with our physicians, our clients, and our patients providing support to our offices on workflows to make sure they're maximizing their success and providing the highest quality of care.
All right, thank you, Tanner. So, and I'm going to ask a couple of my people who are listening this, because we do have a new mic, we are investing in this, so then things are getting serious. So if they have any issues hearing me, I don't think they should, but in case they are.
Yeah, from my end, it sounds good.
All right, so and Christian told me that if there's any issues, he will let me know. Okay, let's go ahead and start. So this is, again, now it's pretty much what we do every week. It's not really difficult to get prepared for what we are sharing with you, because we already have several meetings throughout the week with our providers and staff, and many of the items are being shared and prepared for those meetings as well. Now, today we are going to actually continue on the discussion with medical practices, private medical practices, our role in the medical community, and the issues, challenges that we have with the vaccine rollout. And then I do have some other updates as well as Tanner. So we always start with our overall updates, nationwide updates, with the total number of people who lost their lives. We are almost at 450,000. And with the 26,359,000 confirmed cases and 16,073,000 patients on the recovery side. So as you can see, the numbers are bad. There's no promising numbers there. Now, what I would like to share, which I do it pretty much every week, this summary that you have, it's good, but knowing where the last 2 days were is important. So if you look at the last 2 days, we are at 160,000 new cases. 4,256 people died 2 days ago. And yesterday, that number was about 3,919. And today, so far, what's reported, it's just 12 noon here, it's 347. But usually, once they are done with the numbers, those numbers do go up. From here, we'll take you to Delaware, and from the state updates, the total hospitalizations are getting a little bit less. I think that's a good sign. They do make the issue of they're, I think, confused with seasonal changes. So in January, we always expect higher hospitalizations. So, Tanner, in my old life, I ran the hospitalist program for two of the programs for more than God knows how many years. One is 5.5. The other one is probably 6. Hospitals are internal medicine providers who only works in the hospital. I started the Bay Health program. I started the St. Francis program for the hospitalists. We were one of the 2 at Christiana. And the hospital, from that side, you would know why these numbers are important to compare for the season, not like you don't take the January number and then compare with July. So now from that point, that's not available from the state website, but what's available to us is our United Medical ACO numbers and our hospitalizations compared to last year, same time is, it's about 20% less. Am I getting some technical issue there?
I thought I heard a little bit of feedback for a moment.
Okay, so let's see. Let me just adjust the speaker for a second. All right. So from here, we see our total new positive cases also, the total number is going down, but not enough because it's still very high in the total comparisons. Now, Tanner, you actually give us our United Medical numbers. Tell us how these numbers are comparing to the state numbers.
Right. So the few main metrics that we want to look at here that we present on regularly are our positivity rate. So how often our patients' tests are coming back positive in regards to or in related to the amount of tests that we're actually ordering. So that's what our graph down here is showing. Our amount of tests ordered is hovering right about in between that 200 to 250 mark. Which is still, it's a good amount of tests. We had marked that 300 level, Kemal, as our guide or our target goal for our practices some couple months ago at this point, because we want to really reiterate that we want to continue to make sure we are ordering these tests for patients, making sure that our patients are getting tested should they have any type of symptom related to COVID, just to make sure we're getting an accurate picture of the spread of the disease in our patient population. So we did hit just right around the holiday season, we hit a height of about 29% positive for our test orders, which was trending towards the all-time high there for the pandemic, that seeing the number that we saw early on in March or late March, early April. So we're still hovering around that 27% mark right now. Early data for this past week is showing about 30. So we do expect that to come down just a little bit, as we've only resulted about 23 orders from that week. We're still trying to get in the amount of orders there for the week. So we'll get a better idea of that next week for everyone. This is something that we've also been keeping track of, which has been promising. And I like to think that in addition to a lot of our outreach and our advocacy for patients getting their tests completed, a lot of patients seem to be going through with the orders, which is promising. Our positivity rate for the last few weeks dropped, so we did expect to see this drop here reflected as well in our red bar, as well as our blue and yellow bars, which represent our patients that are getting orders but not getting the tests completed. So we're seeing a drop in that as well, which is really promising, Kemal. That's going to help us get a much better idea on how accurate our data is.
Oh, that's great.
Mm-hmm. So just what makes this really important, making sure that we're getting as many tests done, is just the fact that we see at least between 12 and 15% of Delawareans are cared for by our physicians. So that's a significant amount of the patient population here in the state. We saw close to 500,000 or 500,000 appointments this past year. So we really wanted to make sure that we are taking care of the highest quality of care for those patients, as we have a large footprint here in the state of Delaware. Most of our, or a large majority of our patients in our appointments this year
So like Tanner, like you are in charge of the, you are part of the business development. And
Yes.
you do a lot of other stuff directly with me. So what you are saying is that your company, your organization represents 15% of the population, maybe more than 50% of the sick population, because not everyone is going to a doctor. So,
Right.
and this is important because it's important for our discussions that we have with what we would like state and the federal government to do, and
Exactly.
understanding where the medical practices are and what we can, how we can actually overcome these issues together. That's one of our goals here. Now we
Right.
have a lot of vaccine updates. I know again we go through these pretty much. You know, these days every day is this is what we do. Getting numbers from different places, getting wrong numbers, right numbers, and just never stops. So, and then we have to take the numbers and then just go back to our patients in some cases. Now, the vaccine rollout is, it's in own class. It's a big disaster, unfortunately. However, we are going to overcome this. We are not going to be part of the problem. We are going to be part of the solution. Right now, we are on the phase 1B, which means that patients over 65 can be tortured by going to one of the public places and then wait for about, where did I have my stuff? So a little bit, so I'll share those. Maybe I was going a little bit too fast, but you can be tortured at DME. You don't need to change your driver's license. You can go to DME and get your vaccine. Now, if you may be 87 years old, and be in the car by yourself and then wait to be vaccinated while your primary care does not have the vaccine, but they have the medical staff to do that. So that's the great allocation, and we are really proud of our decisions from the state level, really not. So tell us, Tanner, what 1B means for others.
Sure. So with 1B, we are getting into the next phase of who is eligible to get the vaccine. As phase 1A was comprised of our direct medical staff, medical emergency agencies, and long-term care residents, or we're getting now into more of a phase that includes their patients, right? So you mentioned 65 and older, as well as some of the essential frontline workers, and we'll get into of course, like some of the logistical issues that we're seeing with the rollout here in a little bit. So right now we're really prioritizing that person's age 65 and older. So this is something that we're keeping an eye on, constantly updating as we're getting more and more news in for the different types of vaccines, right? It's important to understand what exactly the side effects for these vaccines are, how they work, how they act, and any challenges that we may have in storing them. So that's the information that we're seeing here, whether it be the storage requirements that are going to be different, or the amount of doses in between the Moderna and the Pfizer vaccine, which are the two we have in the state right now. So just keeping an eye on the right side, you'll see I got a little bit of data on initial data from the Johnson & Johnson trials that are coming back. So phase 3 clinical trials are wrapping up for them. We are seeing a little bit of data come out of those trials, but although nothing is finalized. Although this is a different trial that did just wrap up, come on, I was reading into this morning, our Novavax COVID-19 vaccine, they did just wrap up their phase 3 clinical trials over in the United Kingdom, which showed about a 90 or 89.3, so roughly about a 90 efficacy rate, which is comparable to the two already in production with the Moderna and Pfizer vaccines. So they'll be applying for a federal emergency use over in the United Kingdom here in the next week or two. So that's something to keep an eye on, as we'll see it, I'm sure, move this way at some point. Something, though, to note with this one that I found interesting was actually in their early trials, they were able to confirm its effectiveness against the variant that they are also seeing spread in the United Kingdom, which was an interesting, rather than them having to go back and test it and tweak it, they already know that it's going to be effective. Kemal, I think you muted yourself. I saw you were trying to say something.
I was trying to help you. So, you know, I hate to mute. So Well, in case our people don't know, the tenor actually is right behind me, so he's in the other room. So that's why we kind of have to make sure the echo is not happening. So now, one of the issues that we see is the vaccine allocation, distribution, and administration of it, administering of it. So, and you have some numbers on there. Tell us what those are.
Yeah. Yeah. So with the vaccine, the troubles that we're having with the vaccine rollout and the administration of the vaccine, something else to keep a close eye on is going to be how many doses are actually being allocated to the state and then how many are being administered once they're allocated to the state. So here's some data that we get from the state website. So the state website is reporting on their data from Delvax, as well as getting their information coming in from medical practices providers directly. So right now, the state is saying that we have been allocated 120,000 doses, with about 87,000 being administered, leaving about 33,000 doses left remaining. Now, this data was as of yesterday, what they had on their website. And something else I wanted to keep track of here is just that's we have our graph down here of the cumulative doses that have been allocated to the state. So this is kind of helpful because it shows where the spikes are, how quickly we are getting into it, which is of course represented in the slope of the graph. So you see it is tapering off a little bit here at the end. We're kind of plateauing, as that's something that the state has been mentioning over and over again, that we're starting to see some issues with the amount that are coming into the state, which they are then saying is trickling down into some issues we're seeing allocated, although we'll get into those issues a little bit here. And that mark we have right here, I think this is a helpful point to keep in mind and to continue to share. So at least with the ACO, in the United Medical ACO, we began our phase 1A distribution to our medical staff right at that point, Kemal, where it was January 14th, and there was about 38,000 doses already in the state. And that's when we first received ours. So I wanted to make sure we brought that up. It's going to be an interesting point going forward. Mm-hmm. So then in relation to the state data, here's the data coming straight from the CDC. So the CDC gets its data directly from the federal government, of course. So they have, for the state of Delaware, roughly more vaccines distributed with a little bit less administered. So we see, of course, we're going to get a little bit of reporting delays coming from both entities. But it's definitely interesting to keep an eye on so we can see and make sure that the discrepancies in this data aren't going to get too different or too glaring. So another thing that down here on the left, we're just keeping track of also the amount of vaccine per Pfizer and Moderna that are being administered. So each of those have eclipsed 10 million doses now. So interestingly, Kemal, I know this is something that we both kind of briefly discussed, and I know that you had kind of done a little bit more reading on as well. It's one thing to have some logistical issues with the vaccine rollout, and we all want to make sure that this is a problem that's addressed pretty readily and quickly and efficiently. So I feel like it's something that it's going to have to be tackled head on all levels. And it's something that we've been discussing over and over again with the failure and the inefficiencies in the state. So that's not just the case there, right? We're kind of seeing that on a more federal level as well.
Sure. So, Tanner, part of this session for me is when I have one of our people who are new with the company, we actually tell you guys how to do certain projects, what to do, how you are training, who you are training, and how the organization works. So in this setup, we believe that in any kind of organization, when you go into the blaming games, there's no end.
Right.
Now, Susan Anderson, our Chief Operating Officer, who's been with me for almost 19 years, 20 years actually, in 2021, we started in 2001. We've been working together. I have my responsibilities. She has her responsibilities. One thing that's for us always the case, no excuse, nothing is impossible. So we don't come up with unnecessary excuses for the shortcomings. So now we usually know what we are signing up for. Now, and I want you to also kind of understand this in a way that when you have a new administration coming in, so they already campaign for that for 1 year at minimum. So during that time, you know what the problems are, and you kind of know what you are signing up for. And then you actually get that job by criticizing what the former one did wrong. So then that's why people said, well, I think we can do a better job. So you don't do a job that's not, that doesn't have a clear job description or clear, clear issues. Because it's very different. In business, it's different. In politics, it's not. So you can't just blame the old ruling party for everything that didn't happen or is not going to happen. So now, what I need you to remember also, Tanner, is, well, some of the people are same. So yes, the president is different, but the national advisor is the same, right? Dr. Fauci didn't go anywhere.
That's correct. Yeah.
Actually, I'm going to take my Dr. Fauci love level from, I used to love him a lot. It went down. Last week, it was kind of like I was debating. And after what I've seen, it's down to like very low level.
That looked low.
Huh?
I said that looked low. Quite a drastic change.
Why, right? So 80-year-old physician doesn't need a job. If you believe the person who's in charge of you is not letting you do your job, get the hell out of there. Now, you, Tanner, you need your job. And you may just do stuff that you may not agree on because you don't have that, level of luxury. Okay? But if you're 80, you're done. So you can go back and start blaming people. So now I don't want to make this too political because we are independent. We are, whoever is doing the right thing, we are on that side. So the only reason I'm actually just mentioning this a lot is because everything is just turning into, well, Trump didn't do this. Well, what was Fauci doing there? I told you he was fully in charge. So a couple of the face gesture that he had in some of the meetings, we didn't know he was so unhappy. I wish he just called one of us. We could just make it kind of public for everyone. But here's what I'm reading. It's all about blaming, and let's just focus on what needs to happen, because we are really putting a lot of effort to tell our state, look, we are here to help. Utilize us. I have medical staff. I have medical locations, and you are not utilizing me. So, well, that's Trump's fault. Well, Trump wasn't in charge of Delaware before the election. So I don't want, this always happens to me, Tanner. I never liked Trump in my life. I don't like the guy. I won't like the guy, but they make me sound like if I'm a Trump supporter. That's the stupidest thing someone can ever say if they know me. But he cannot be the getting out of this trouble issue. Like, do your job. So your job is, well, you've been telling everyone that what needs to be done. Like, there's no surprises. Like, we didn't get the pandemic today. It started last year in January. So, like, they were fighting in here and there, but let us know and get us to the the clear view of what needs to happen, because you are not helping. Now, when I say you are not helping, I have to kind of be on the local level. And I was part of the town hall. I participated in the town hall just to listen what's going on. I think, Tanner, you also listened to that, right?
Yeah, Kemal. I definitely think I was able to tune into this town hall event, and I thought that it was pretty informative because it really painted a good picture of where exactly we do stand in the vaccine rollout for the state, because it's interesting to hear one message really put forward, but then be able to see kind of the shortfalls and the shortcomings that are going on with the vaccine rollout from our perspective, seeing the lack of interest in the private primary care setting. Meanwhile, and we kind of get into it here if actually you want to go to the next part, Kamal. Just some of the things that I thought were really interesting and important points that they wanted to really bring up and highlight. One was being that big weekend vaccine rollout or vaccine hub, essentially, that they had going on with the DMVs in the state. And they really spoke to the large numbers of people that they were getting vaccinated at these events, as well as the Christiana Care events. Mostly, again, for like that 1A remaining 1A population, as well as our 65 and older. But even though they had these large numbers of turnout that they were discussing, we saw a lot of issues with the actual logistical administration of the vaccine, and kind of really highlighted all the inefficiencies that we've been discussing. And I thought you had an interesting here. You had a good response to some of the issues that they were seeing with those large events, right, Kamal?
So, Tanner, the issue is this, like when we bring up these issues, I know that I'm an outlier in the society in a way that I'm a visionary person and we are game changers. I understand that I'm going to be alone most of the time. So in these, activities and the developments of these challenges that we have to deal with. Now, the problem is, when I did the session last week, our session, I go and then I read News Journal of Delaware, and this picture is, I could have taken this picture, but this is from the newspaper.
Yeah.
That day, I was there for the driver's license address change.
Oh, you went that day?
So I couldn't actually get it done because my 87-year-old patient was getting a vaccine, and they were in the car, and some of them, they were alone. And is that the way that we have to give vaccine? Like, is that how it has to happen? I mean, look at this line. These are not like 27, 28-year-old people. These are all like 80 and older.
Right. I think that that's really important to remember, that this isn't just for this phase and these events aren't just for anyone. That this should be our elderly. This is our 65 and older who are having to get into their cars and wait on the side of the highway for hours. 3+ hours there that was mentioned at the DMV lines, right?
You can actually, if you read this news, I did email the journalist, Brandon, I believe his name. One patient says they waited for 6 hours. 6. So anyway, now everyone knows this. That's why we are a little bit agitated. So that's the other thing. It's not like we have some mental disorder. We see this and we live with this. We have to do the troubleshooting with the patients, triaging the patients, while we are not utilizing, while we are not helping them, because we are not being utilized by the state. So now it gets better from here, and this is for everyone.
Yeah. So another important thing that they did discuss was actually the vaccine update in regards to the second doses. So we're seeing these large drives of people come out at these events. Meanwhile, the whole time they're discussing a limited supply of doses actually arriving into the state for the remaining 1A and 1B population. So what exactly does that mean for us, or for anyone who is eligible to get a vaccine and or has already gotten their first vaccine? Well, they're starting to say that we don't want to necessarily be prepared for that 21 to 28 day window for the Pfizer and Moderna vaccines, but actually with the amount that is coming into the state, they want to shift their focus from getting that second dose into the arms of that first dose, making that not necessarily the primary target here, but focusing more on getting the first dose. So they kind of discussed information that is important to know forward-facing for the public, that with the first dose, it does actually provide about a 52 to 80% protection, which is honestly, when you go in to get your flu shot, that's what you expect. That's a good efficiency rate for even like a flu shot. So that's good news. But it's a little discouraging that they're getting to the point where they have to kind of ration this and not just be able to promise necessarily someone in a timely manner that they can go ahead and get their second dose. But instead, we're seeing a kind of a strain on the amount of doses coming into the state, which is then having them to kind of readjust their vaccine rollout. So they mentioned, again, prioritizing first doses. And they also mentioned making sure that we are aware that the first dose is going to provide some protection, and to try not to get stressed out about that second dose. So then this did come out in a message from the state. So this is kind of what they were communicating going forward now that this is their stance, that the CDC does mention that there's a good interval of 42 days that's acceptable, and kind of just reiterating the limited supply of vaccine in the state is kind of having them to change their plan with the vaccine rollout right now.
So Tanner, when these things were happening, I wanted to help one of my friends who's over 65, because we couldn't do his vaccine through our practice because we didn't get the 1B vaccine at United Medical Clinic or any of the offices of United Medical ACO. I said, okay, I'll help you. And I registered my friend with the state. And this was Monday. I didn't hear back anything from them until last night. And I do want to share this email. I don't think I was able to review this with you. So it was kind of like a last minute.
Yeah, I'd be interested to see it as well.
So now this is an email of my friend, and then this is a template response that we got from the state. This is the first part. It's been a week since Delaware opened waiting list, blah, blah, close to 100,000 people. And I really don't know who the 100,000 people is, but fine. 10 people from the list vaccinated drive-through clinic, Saturday, Sunday, 750 drone. Okay. We at the Division of Public Health, thank you for wanting to protect yourself, your family. Oh, great. So this is still the email. So all I need to know is when he can get his vaccine.
Right.
And this is the second part of the email. Most common questions we have heard from people who sign up has been, why have I not gotten the invitation? Simple, you don't have the vaccine. Okay, but then like all the stuff that's given, the numbers don't match up, but I'm not gonna get into that. But this is 4 days later, this 80-year-old received this email. Now, my father, who lives in Turkey, he got his vaccine last Wednesday. I mean, this past Wednesday, and he's 80, he's going to be 80 in a couple months. So I will want him to go through that and not get any update for 4 days. And when this patient calls the primary care office, we have no answer. The answers are all changing every day, every minute. Something really interesting happened right before this call. One of our practices sent a message saying that they got the 1A vaccine just today. We knew for a fact that there was not going to be any delay. So anyway, the last part of this email is, if you haven't received the invitation for your vaccine because we don't have it, then they just go to your medical provider. Well, I want public, because now the state is changing their talks. Primary care providers were not engaged in any of the vaccine allocation distribution discussions, period. My name is Kemal Erkan, again. I'm the chairman of United Medical ACO, representing 116,000 individuals in Delaware. I have not been in any of the state discussions, official discussions, to see when we were going to get the vaccine. It's all about us harassing the emailing the state to see, can you give us an update? Can you give us an update? We are not part of the decision making.
Yeah.
So, go ahead.
Well, yeah, sorry, Kamal. Something that I found really interesting as well, because I think a lot of people might not necessarily be able to hear this from the primary care end, is this is something that we've been discussing for the past few weeks, right? And it's a big issue for our ACO and for all of our primary care practices. But I think it's important to reiterate that this isn't just something, as I sit here, let me make sure my light comes back on. It's not something that
we are green offices, so
making sure it goes out. Well, this isn't something that we're just seeing as our ACO, but this is across the board. This is primary care across all of Delaware. So when we tune into those conference calls over the phone, which happen now, I guess, every Wednesday with the state of Delaware, we hear from primary care offices across the state that are coming in with the same issues. They're applying for the vaccine. They're not getting the vaccine. They haven't been receiving news or regular updates as well. So this is something that it's a much larger issue on the side of the primary care, especially as, like you started to mention, they're starting to address it on more of the state level or bring it to the forefront with the primary care collaboration that's going in front of the Senate or those committees, right?
So that's like one of our agenda items, right? So what we know is when you don't have primary care offices, some primary care offices, they may be upset with me when they hear it. They deserve it. They deserve to be treated the way that the state is treating them, like afterthought, because they are in their offices isolated and they're not interested in the clinical integration. We are United Medical ACO. We are the first clinical integration example in Delaware. So we cannot be treated just like any other primary care. We represent close to 200 providers just in Delaware. So at some point, someone's going to hear this. So, but it's my public duty. If I don't make this available, and if these issues are being going to the blame game, we need to move on. We need to start looking into the future and then see how we can work together. We are not competing with anyone. We need to do our jobs and we need to help our patients. So when we have metrics all over our contracts, and just from the doing standpoint, when we are putting ourselves at a higher standard, and then not being able to vaccinate my people, that's a crime. So this is again the issue, just so that everyone, Tanner, I guess everyone would know that this is MGMA. I was the Life Achievement Award winner for MGMA last year. As you can see, I'm very humble. So just feeding myself. So 85% of the independent practices, they cannot get their vaccines. 85%, this is nationwide.
Right.
Okay, so there's something wrong.
You will notice though, Kemal, just even in this graphic, again, being a nationwide vaccine access poll, the demographic here, the graph that shows who's really not having the large access issues to getting the vaccine is that the hospital systems coming in at 55% being able to at least easily get it according to this poll, right? So
we don't have good accountability for that.
No.
We don't know who's all getting it. Like, again, the primary care is left out, and I'm responsible to report the vaccine to the insurance company for the quality standpoint. Like, that's really oxymoron. Like your main responsibility is taken away from you and giving it to your competitors. So then, like, this madness has to stop, people.
So that's something that I think that they were coming up with as we look forward into the next week, and something that I took from the that town hall meeting was they kind of went over some lessons learned, and the things that they focused on were like their logistical concerns with the traffic that we highlighted, spreading the information to the public. I know that they were saying they were having a lot of people line up in those lines, thinking that it was just kind of giving away vaccines, when really you had to have a registered appointment. You had to make sure that you were there and you were eligible population. They even brought up something with the weather impacting the day, Kemal. But even after mentioning that one of the things that they wanted to promote and kind of take away from this was to get the primary care community more involved, not once did they really bring that up as a lesson learned or something that they want to kind of improve on going forward. So I kind of took that away as a big highlight of the town hall.
You know, what I'm really worried about, and I hope it won't happen, Tanner, I'm just worried that we are going to lose some of our elderlies while they are waiting for that line. Because it's negative, what? It's like 20 or 15 Fahrenheit outside.
It's cold. It's really cold.
It feels actually even more than, I mean, less than that. So then they have to run the car. They have to keep the car running. So you tell like 5,000 people to go to one location.
Yep.
All the qualified staff, like RMAs, who knows the vaccination better than anyone in the state, are not part of it. Just think about it this way. Like, what's my personal gain from it? Zero. No personal gain. I have to be able to do my job. My job is, I'm part of this society. I employ MAs, doctors. I provide services for doctors, and we have workforce to help. If they were to say, Kemal, DMV requires 20 of your MAs on that day that I couldn't do my license update, then I would be able to talk to our MAs and then say, okay, here's 20 people that can expedite the process. They didn't even think about it. I go there to just, constantly emailing and trying to get their attention is, at some point, it's exhausting. And, we have a surgery center. Because of the pandemic, we have limited number of cases. In the afternoon, I can vaccinate people. I have 17 full-time nurses not being utilized, John Carney.
Right.
So in North Wilmington, your parents live close by. We could have vaccinated your parents at the surgery center. It's safe. They don't have to be waiting for 3 to 6 hours. That's inhumane.
Right. And we were able to highlight that.
We just have an issue with the current situation. Please, let's move on and just take this to a different level. Now, so we said enough, stuff. So I do have a request from the Biden administration, and we are going to put this through Chris Coons. Hopefully he'll support us because I didn't reach out to him yet. But we have an issue. They all try to help how you can help primary care or the medical practices. So because of the pandemic, there was a great program from Medicare. They actually advance payments from our future earnings. Medicare Accelerated Payment Program. So in the Trump administration, it was given very quickly, and it was updated where we didn't have to pay it in the initial terms, so they extended those terms. Well, dear President, so we are asking you, and it would be a great help if that becomes part of the stimulus package and is forgiven. Because right now we owe money to the state, to the federal government. So you ask what could be done, what can be part of this, what can help the medical practices. This could help. So we have to pay this in the next 12 months. This was a great way to make the primary cares and private practices powerful in a way that we had the financial support, but now we have to pay that back while we are going through the worst part of the pandemic. And I am officially requesting on behalf of all of our private practices, and I can make this request through MGMA perhaps, we need this loans. See, it says I'm not lying. Medicare loans made to providers, accelerated. Hear our voice and help us with, I promise I'll be nicer in the next several sessions. I do this for my practices, not for me personally. So our new president signed 10, 11 different executive orders. None has anything to do with the medical field. We are going through a pandemic. We need help. Our providers need help. We all need like mental support. I can tell you that because everyone that I talk to these days, they're kind of going crazy. So it would be a huge help where we don't have to be feeling the weight of the financial responsibility. So that would be a great help. Now, I know today we are kind of maybe it's going to be a little bit longer, and because we do this live, so it's recorded. So if you don't watch it live, that's fine. We are not going to be upset. But I know over the weekend everyone is going to watch it because I have a session that we need to complete, right, Tanner?
Correct. So I know we wanted to also still touch on like our representation, right? In especially coming up as a big thing that's going to be discussed is how the primary care role in the state needs to, in the words of the Senate committee, be reformed. So I think the mission statement there, and we might have something a little bit into or a message going with that, is to kind of like increase the collaboration with the primary care setting in the state, and to be able to better provide health outcomes to our patients. And I think that we've really seen a failure there with the collaboration, where the pandemic has really kind of pushed us to be able to be innovative in the healthcare setting. And as we're seeing with like sessions like this and more public awareness, transparency here. But one thing that we're not necessarily seeing is that extra collaboration that they kind of discussed was going to be an onset of the pandemic and something that they really wanted to focus on.
So Tanner, here what I would like to kind of tie this into is there is a Delaware Healthcare Commission. There are no representation of any of the accountable care organizations other than the hospitals. There are two private ones, United Medical and Allied. We can participate as a public guest, and I go there, and then we have Randy Monson from United Medical, one of my consultants, advisor. He goes there every month on my behalf as a guest. So then just because we want to be up to date with what's happening, one of the agenda items is primary care reform collaborative. So what is this, as there are 3 agenda items or 4? So then you are not part of them. There are no primary care in this committee that can make that decision or represent the primary care reform. So you want to do a reform and you don't want to include primary care representation is the worst thing that you can do in any kind of meaningful activity. So people can actually read these. There's a Senate Bill 227 and there's one for 116. This talks about how we can actually change the healthcare delivery in the state of Delaware by utilizing the value-based practices. So you don't have any representation from private practices and from primary care. So let me actually just share who the board members are, because this is public. Everyone can just Google and find the same information. So healthcare committee is the highest committee. And then one of the agenda items, again, is primary care reform. Yeah. Primary care reform. So there are some Senate's, the official people, they have to be Christiana Care. Okay. And Christine Donahoe is a great person. She's someone I talked to in the beginning of the pandemic, and she's a very nice person. I love her, no problem. But she represents Christiana Care for primary, and then she's going to be the voice of primary care. Medical Society has a ACO with St. Francis Hospital. BB Healthcare Hospital, Department of Insurance, Aetna, Department of Insurance. Westside, which is affiliated with Christian Hospital. Westside is one of those, I say affiliated because their CEO is the board member of Christian Hospital, Lolita Lopez. Highmark, and Delaware Nurse Association. So this group, we have zero problem at the personal level. So when it comes to reforming the primary care, none of these people are representing or qualified to do that on their own. How difficult that is. That's all we are trying to say. So I have to still do everything, and I have to be the visionary. I have to be the first as an ACO in everything that we do in Delaware, and we are not able to represent ourselves in these committees. Mm-hmm. I don't actually have time for committee membership, but I have a leadership team here who have. So I'm not looking for membership on any of them, but I have directors who have time. We have two of our directors, they are on some of the subcommittees, but the decision-making, the top committee is making reforms in primary care are the hospital systems. That's the most ridiculous way of doing any type of business in medicine. It's pretty clear. Now, I don't want to, of course, stop here, but for today, we are about to wrap this up. So, my therapist said that keep this for 60 minutes, Tanner. So, so then here's our patient portal. Our patients, if you are, and I know you're watching these, please use the portal. It's a very friendly way to communicate with this. Like the worst thing that you can do to yourself is calling us to cancel your appointment or getting your medication refill and then be on the phone for 20 minutes and then you get so upset and then you hang up and then you put really mean social media comments. Well, we don't do much on those because we can't. You have to use the patient portal. Very clear message. Use the patient portal, please. We have a lot of events that we have done. This is, again, pretty much settled on Fridays. We have our bariatric events on Wednesday with Dr. Kemal Erkan, and we have our diabetes. We are one of the accredited diabetes centers in Delaware, and Amy Wilkinson is our program director there with Dr. Ripu Handal, and we do second and fourth Wednesday, and these events are happening. Now, if I may take 2 more minutes, and I promise you I'll shut up at some point. Every time we have these events, we do actually bring up different issues. And I forgot to mention that our St. Francis program with CRIAS for the bariatric. But what I want to share is the video that I did with live session that I did with Dr. Erkan. I mentioned this, I believe, a couple of weeks ago, and I don't see any harm not to share this again. We have done the second session for the Ethiopian Tigray conflict. I didn't mention this before, as I said, so I do want to make sure that you are able to find this video and watch this because we want to make sure that everyone is aware of what's happening while we are trying to be extremely healthy. Like, it's a really great problem to have 23% of our Medicare population is over 80 years old. That means we are pretty healthy, right?
Right, yeah.
Other part of the world is not that lucky. And that is, let me just share this. That's with the trouble that we see in the Tigray region in Ethiopia, and a lot of people are being now in the refugee camps, and the lives, like the starvation, rape, people's homes are being destroyed, and then all this is happening right now. So please watch this video because we did this on a Sunday. It was about 40 some minutes. Dr. Erkan, who actually was one of the victims of this type of problem crisis in 35 years ago, like in the last 30, I think it was 35 years ago. So this is, this double standard of this world. We want to stop. We don't have any problem with this young lady here, but her dreams are being stolen while some other people are being raped and dying from starvation. Please, it's my responsibility to just remind this. And I'll do more sessions on these with Dr. Erkan in the future until we get the attention of everyone and then make everyone aware of that. This is also my community. So we are not going to actually, again, be quiet for any. As you can tell, I'm just saying for our people who are watching us, we are pretty vocal when it's about our feelings, and when we believe that we are right, we'll be louder. And this is one of those issues. And just like our medical issues, that the medical primary care, private practices, as we have those issues, we are very strong. We are going to be strong on the other side as well until we find the justice. So that's what we have from today. Tanner, anything you want to say before we close?
That should be everything for today. Hopefully everyone has a good weekend. Stay safe. Appreciate everyone who's taken their time to watch and support us.
I just realized that my dad and my picture is right behind you. If my dad is watching, he's probably going to be happy. That's my dad right there. So
right here.
I'm hoping he's watching. He doesn't speak English, but he still watches these events. So thank you so much for being with us, and we'll be back next week. Thank you. Bye-bye.
Thanks. Bye.